Hello, my name's Peter Cutting. I'm an emergency medicine consultant here at Leeds Teaching Hospitals. CEMBooks is a really vital tool for the work that I do on the shop floor as a jobbing emergency medicine consultant, but also I have a responsibility within the department to work in risk management. And really for me that allows me to look at the environment that incidents or events that have gone badly have occurred in. We all know that human factors are very important in the way that we approach analysing incidents these days. And it's very difficult to actually do that if you don't have the context of the department when an event occurred. CEMBooks gives you the ability to have live logs that tell you what the department was like and give you a narrative that gives you a feel for what the department was like. It's much easier to explain to people how bad things happen when you have that level of depth of knowledge of the department at the time. So CEMBooks allows me to have a real depth of knowledge of how the department was when an event may have occurred. It gives me information on staffing levels, it gives me information on business of the department, both with attendances coming into the department and also the number of patients who still remain within the department. It allows me to see if there's been a particular case that has taken senior decision makers away from the shop floor and allowed other areas of the department to have less cover. The other thing it really does is it allows it to be really very easy. Because I can look back at specific dates and times, I can see when events have happened, and that makes it much more helpful for me as an investigator to be able to look back in real time and see what was occurring. And it makes my job as an investigator and as a safety specialist a lot easier. As you're probably aware, there's a new National Patient Safety Investigation Reporting Framework, which is the new standard that the NHS is going to use for investigating incidents across the NHS. In CEMBooks, you will have a lot of the information that allows you to populate the way that the investigations are to be styled in the future. There are elements within the human factors and elements within how the department is that's readily available within CEMBooks that helps you populate a report that should be useful as an outcome. So I've been using CEMBooks in our departments for the last 6 years, the last year of which has been the second version. It's revolutionised the way that I've worked, not just in the way that I have been able to provide care on a day-to-day basis, but it does allow me to go back and look at incidents. That has a direct effect on the way that we look after our patients now, because I can look at things in the past and I can then prevent things happening in the future by using the information contained within CEMBooks.